be discussing dental anomalies part 2. So, we previously covered other dental anomalies in part 1 of our discussion. So, in part 2, we'll focus specifically on 8 common anomalies of dental structure. So, let's move on to the first one, which is enamel hypoplasia. So, enamel hypoplasia is a condition characterized by underdeveloped enamel tissue resulting from a disturbance in the apposition stage of tooth development. Do you remember the apposition stage? This describes the deposition of mineralization of the hard tissues that cover the tooth structure, including dentin, enamel, and cementum. So, any disruption in this stage would affect the overall structure of the tooth. One specific type of enamel hypoplasia is Turner's hypoplasia. This type of hypoplasia typically occurs following an infection or trauma-induced inflammatory response to a primary tooth. This disturbs ameloblasts that develop the permanent teeth, leading to an underdevelopment of enamel. Turner's hypoplasia only affects permanent dentition and is seen clinically as a brown tinge on the affected tooth. Notice the central upper incisors in this image. Another form of enamel hypoplasia is associated with congenital syphilis. This is a condition transmitted from an infected mother to her unborn child. So there are two distinctive dental manifestations of congenital syphilis, and that is Hutchinson's incisors and mulberry molars. So Hutchinson's incisors are characterized by a hypoplastic triangular notch on the incisors' edges, and mulberry molars exhibit a globular rounded enamel cusp on the occlusal surfaces of the molars. Next, we'll discuss enamel hypocalcification. This occurs when there's a failure in the maturation stage of tooth development. The maturation, which follows the apposition stage, is crucial for the completion of enamel mineralization. Any disruption during this stage can result in abnormal mineralized enamel, which is weaker and more porous compared to healthy enamel. So it's often clinically seen as white spots of an abnormal mineralized enamel. Notice how the white spot here on the upper left central incisor, we can see that it is white and chalky in appearance and tends to have this kind of tannish, whitish cream color. These teeth are more prone to sensitivity, decay, and often erosion. Next, we'll discuss amelogenesis imperfecta. Amelogenesis imperfecta is a genetic condition characterized by alterations in enamel formation while the dentin and pulpal tissue remain unchanged. It arises due to a disturbance in the Bell stage of tooth development. This disruption affects the subsequent stages of enamel formation, leading to the characteristic thin or absent layer of enamel observed in individuals with this condition. It affects both the primary and permanent dentition and is divided in three different types, which is hypoplastic, hypocalcification, and hypomaturation. So the first type is hypoplastic amelogenesis imperfecta. This occurs when there is a defect in the quantity of enamel. The enamel is very thin, but it is hard, but this is the most common type. Type 2 is hypomaturation. This occurs when there's a defect in the maturation process of the enamel. This is where there's a normal thickness, but this is soft enamel that can wear away easily or break. And the final type is type 3. This is hypocalcification. This is when there's a defect in the initial stages of formation of the enamel. So the enamel may have a normal thickness, but it's typically quite soft.